Today's Debunking the Myth deals with eggs. It's common practice for some to save yourself from all the fat and cholesterol of an egg by eating only the white part and throw out the yolk. Well, Joe has the facts to debunk this myth. We're finding that the yolk is not such a bad guy, huh?
Shirley, if you had to eat only one part of the egg, throw away the white and eat the yolk.
Wow.
There's so many things our government's been telling us. If you do just the opposite, you're probably going to be healthy. What people don't realize...
I'm not going to say anything about that, but just remember, Joe is an activist.
Well, look, here's the issue. It goes back to the chicken, okay? You know, which came first, the chicken or the egg? Unequivocally, it was the chicken. And so goes it with the health of the egg. So if the chicken that you're eating this egg from is raised on a farm where he is getting antibiotics and he is getting hormones and he's cooped up in a chicken coop,
right.
And he is not seeing the light of day, he's not getting oxygen, he's not drinking water from puddles that has minerals in it and from the dirt and so on and so forth, eating bugs, this chicken is going to lay compromised eggs. He's artificially inseminated, or she's artificially inseminated. The yolk in those eggs does have oxidized cholesterol in it, meaning that the cholesterol cell, the integrity of the cholesterol cell has been oxidized and compromised. That cholesterol tends to be very low density and will tend to coagulate in your bloodstream. That's where the facts came from. This is what we have to look at. Where did the facts come from about yolk? They came from government studies. The information from the study was accurate in the sense that cholesterol was found to be harmful, but the chickens that laid those eggs were harmed.
I got it.
The fact of the matter is a yolk in a healthy chicken is full of omega-3 fats. It is full of biotin, which is probably the best brain nutrient I could possibly recommend anybody to take. And then choline and inositol, which is passed on, you know, from the chicken to a would-be chick, which is also brain food. So the yolk is, and of course the protein in the yolk is very healthy. The yolk is full of nutrients.
So just remember to buy those nice brown eggs. Remember that?
Nice brown, free-range eggs.
Free-range eggs, right. Well, we have an email here from Barbara in Illinois, and she had asked us, what's a natural way to stop foot fungus and keep it from coming back? And we want to go direct that question to Dr. Walt Larimore, who's going to be talking about foot fungus.
Well, there are some preventative things. For example, being sure that you wear clean socks, being sure that your shoes aren't old and cruddy, even washing your shoes from time to time. But I think of foot fungus kind of the same way I think of moss. That gray moss that grows from trees in the South. We know that moss grows on some trees better than others. For example, it grows on oak trees very well, but it doesn't grow on pine trees. Why? Because those trees have different types of bark. Well, people are the same way with our skin. Our skin types are different, and some people have a predilection or a sensitivity to foot fungus, and those people tend to get it throughout life. A bitter orange, garlic, and tea tree oil have all been shown in a number of studies to be effective for the treatment of athlete's foot, but not taken orally, only when applied to the foot fungus itself. These products are available at health food stores and pharmacies and may be helpful, although in most studies they're not as effective as the prescription products.
It's always good to know an alternative to the medicines that you would be prescribed, or maybe there's over-the-counter medicines as well. But wasn't that interesting that you take these and put them on topically? Well,
tea tree oil is one of the best antiseptics that you could have out there. I use it for several different things, including something like that. But I think we want to look at a bigger picture just real quickly and say that, you know, you could have 10 athletes come out of the same shower, only 2 of them get athlete's foot.
And that's what Dr. Wall said. It just depends on your skin, right?
Well, I think it depends on your immune system. I think it is indicative of a picture of your immune system. It doesn't mean that you have some big, bad, dark immune, disorder. Right. But what it does mean is that you're compromised. So for you, that compromised scenario might come out in a foot fungus. Okay. You know, for me, it might come out in a repeated ear infection, you know. So the key, again, is this holistic approach. And we're going to be bringing on Dr. Smith in the next segment, Shirley. And, you know, a lot of what he talks about, and I'd like to just address this quickly because Dr. Walt Larimore is kind of that guy right in the middle. Yes. He incorporates some alternative things, so to speak.
In fact,
and I don't even like that term.
He's written a very wonderful book on alternative therapies. So.
And then he will use conventional medicine, you know, and so will Dr. Smith, who's going to be coming on in our next segment. But what we call Dr. Smith is a holistic physician. And what that means is that we're treating the whole self. So if you get athlete's foot, if you get foot fungus, do you treat it? Well, of course you do. But after it's treated, if you don't make any changes, all we've done is put a Band-Aid on it. And Band-Aids are for boo-boos, you know?
Yeah, they
we
are.
don't want to use Band-Aid as a metaphor. So I think we're excited to have Dr. Smith on and have our viewers understand what we mean by the concept of holistic physicians.
Right, and that's what we're all about here on Balanced Health. You know, we want it to be balanced. We know that it takes medicine, it takes prescriptions, it takes surgery and chemotherapy sometimes, but we always want to be able to provide alternative therapies when they can be helpful.
And we want, Shirley, above all things, for people to grasp the notion that God created a healing machine. Understand that your body is designed to heal, and understand that unless you make changes on a holistic level, or as a conventional doctor say, a systemic level,
Yes.
expect no good
That's
outcome.
right.
The good news is those changes don't have to be cataclysmic paradigm shifts. They can be little things that you do every day that are free, that are easy, and that they get the information for on this program. We're going to talk more about that in just a second. Well, for a copy of today's show, call 888-242-9393. Coming up, as we had mentioned, is Dr. Terry Smith, a holistic physician, fascinating guy, fascinating practice, and he is here to answer some questions on alternative therapy issues. Stay tuned. You're not going to want to miss this next segment.